Hello and welcome to our video on metabolic syndrome. Metabolic syndrome is a combination of medical disorders that, when occurring together, increase the risk of developing serious health problems such as diabetes and heart disease. It is also known as Syndrome X or insulin resistance syndrome. The main components of metabolic syndrome include high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. It is important to note that having any one of these conditions does not necessarily mean that a person has metabolic syndrome, but the risk increases when multiple factors are present. The causes of metabolic syndrome are not completely understood, but it is thought to be related to a combination of genetic and environmental factors. Poor diet, lack of physical activity, and stress can all contribute to the development of metabolic syndrome. One of the most significant risk factors for developing metabolic syndrome is obesity, especially abdominal obesity. This type of obesity, also known as visceral fat, is located deep within the abdominal cavity and surrounds vital organs such as the liver, pancreas, and intestines. This fat is highly active and releases hormones and other substances that can increase the risk of developing metabolic syndrome. People with metabolic syndrome are at an increased risk of developing serious health problems such as diabetes, heart disease, and stroke. Diabetes is a chronic condition in which the body is unable to properly use and store glucose, a type of sugar that is the main source of energy for the body's cells. When left untreated, diabetes can lead to serious complications such as nerve damage, blindness, and kidney disease. Heart disease is a term used to describe a range of conditions that affect the heart, including coronary artery disease, heart attacks, and heart failure. It is the leading cause of death worldwide, and people with metabolic syndrome are at an increased risk of developing heart disease due to their high blood pressure and cholesterol levels. Stroke is a serious medical condition in which the blood supply to the brain is disrupted, leading to a lack of oxygen and nutrients. This can cause damage to the brain and can be life-threatening. People with metabolic syndrome are at an increased risk of stroke due to their high blood pressure and blood sugar levels. The good news is that metabolic syndrome is preventable and treatable. Making lifestyle changes such as eating a healthy diet, getting regular physical activity, and managing stress can help prevent or manage the condition. It is important to see a healthcare provider regularly to monitor blood pressure, blood sugar, and cholesterol levels. Medications may also be prescribed to help manage specific symptoms of metabolic syndrome, such as high blood pressure or high cholesterol. In some cases, surgery may be recommended to remove excess fat and improve insulin sensitivity. The bottom line, metabolic syndrome is a serious medical condition that is characterized by a combination of medical disorders that increase the risk of developing serious health problems such as diabetes, heart disease, and stroke. Making lifestyle changes and seeing a healthcare provider regularly can help prevent or manage the condition. Thank you for watching our video on metabolic syndrome. If you have any questions or concerns, be sure to discuss them with your healthcare provider.